Hello guys, Vanakkam and welcome to Meet International Academy, one of the leading academy in training nurses and nursing competitive exam as well as IELTS and CLEX and weighted training. And we are discussing the magic pill session. So every day we are discussing 5 MCQs which is already asked in the previous year exams with the rationale, with the key points, each and everything we are discussing very clearly. See, we are taking the effort for you guys. Okay, so what you supposed to do is listen and watch to the videos, and whoever is in need for undergoing any exams, for example, upcoming NORCET or JIGMER exams, ask them to watch the videos. Okay, and if you are going to face the exam, please watch the video. Okay, fine. So today we are going to discuss about pharmacology. Okay, so let's start the session without wasting the time. A patient received codeine sulfate for severe back pain. Which of the following observation must be done by the nurse? So this is the question. So here in the question, they have clearly mentioned that codeine sulfate is taken by the patient. It is a painkiller. It is used here for this patient for back pain. Okay. And as a nurse, what observation or what assessment you supposed to do? This is the question. Okay. The key point is codeine sulfate for severe back pain, and what assessment as a nurse you supposed to do. So here you can see 4 options like monitor fluid volume, monitor bowel activity, monitor peripheral pulses, monitor for hypertension. 4 options they have given here. For solving this question, you should know the side effect of codeine sulfate. If you know that, it is very, very easy to solve this question. Okay, because it is a direct question. So here the right answer is option B, that is monitor bowel activity. So why we selected option B, monitor bowel activity? The rationale behind this is actually the codeine sulfate, it will cause decreased bowel motility. Okay, it will cause constipation. So constipation is the main side effect of the codeine sulfate. It decreases the bowel motility. So as a nurse, we need to auscultate the bowel sounds and check the stool consistency. Okay, so that's why we selected what? Option B. Apart from that, other vital points are, if the patient is taking codeine sulfate, so ask the patient or health educate the patient to take at least 3 liters of fluid if it is not contraindicated for the patient. Understand? Underline the word, if it is not contraindicated to the patient, advise the patient to drink 3 liters of fluid in order to avoid this constipation effect. Apart from that, fiber-rich food you can advise. And then very, very important point related to this codeine sulfate is assess the patient pupillary reaction to light. Okay, we have to check for the pupillary reaction to the light. Why we need to check the pupillary reaction to the light? Pinpoint pupils, if it is present, means it indicate there is a overdose of codeine sulfate. So in codeine sulfate, you can check for what? Pinpoint pupils. Okay, so as a nurse, what are all the things we supposed to check if the patient is taking the codeine sulfate? First, you have to assess for constipation. Okay, ask the patient to take a fiber-rich food, drink more amount of fluids. Okay, and the second thing, very important thing, what you're supposed to assess is pinpoint pupil, because it is the complication, that is overdose of codeine sulfate will cause what? Pinpoint pupil. So these are all the 2 vital points you're supposed to remember when you are coming across the question with codeine sulfate. Okay, so let's go to the next question. All the question what we are discussing is asked in the previous exams, that is NORCET, JIGMER, ESI, RRB. From there only we have collected these questions. Okay, fine. So which of the following drug is not used as antiemetic after recovery from anesthesia? So this is the question. Here the keyword is the patient is recovering from the anesthesia. Which drug is not at all used? It is an except question, not used in antiemetic after recovering from the anesthesia. Direct question. 4 options. All the options they have given trade name. This question asked in JIGMER examination. Okay, so avomine, largatil, stimitil, and pethidine. Okay, so pethidine, once you hear the name, immediately what is coming into your mind? Pethidine is a opioids. So definitely it is not going to be coming under what? Antiemetic, right? So here you can directly go to the answer, option D, that is pethidine. It is the drug which is not at all used as a antiemetic because it is a synthetic opioid. That point also I have clearly mentioned here. Pethidine is a synthetic opioid used to relieve the severe pain. It is not at all a antiemetic. Whereas other drugs, whichever I have mentioned here, like, avomine, largatil, semitil, all these drugs. First, we can take semitil and largatil. It is, even though it is a antipsychotic drug, first important point, antipsychotic drug, still it is used for preventing nausea and vomiting. Okay, and another drug, avomine, it is also called as phenothiazine. It is an antihistamine which is having sedative effect, but still it is also playing a vital role in preventing the nausea and vomiting. So Semitil, Largatil, avomine, these drugs we can use as an antiemetic after recovery from anesthesia, whereas pethidine, it is not at all used because it is an opioid used only for relieving the severe pain. So here, which is the right answer for this except question, not question, the right answer is option D, that is pethidine. The next question is, morphine should not be used in which of the following condition? Very important question. This is repeatedly asked question. Okay, morphine should not be used in which of the following condition? Direct question. Okay, so 4 options they have given here: pulmonary edema, angina, stroke, and bronchial asthma. Very simple question. Hope you have got the answer. See here, the right answer is option B, that is bronchial asthma. So why we selected bronchial asthma? So what is bronchial asthma, guys? So there are many causes which is triggering the bronchial asthma. The main cause is allergic reaction. Whenever there is an allergic reaction, the histamine secretion will increase. That is the one which is causing the allergic reaction, right? So how the bronchial asthma is related to morphine? So first you should know what is bronchial asthma. It is because of allergic reaction, especially the histamine secretion is increased because of any kind of allergy. So that time the bronchial asthma condition is worsening. Okay, so if you are administering the drug like morphine, it will further trigger the bronchial asthma by increasing the secretion of what? Histamine secretions. It will increase the histamine secretion further and it will worsen the bronchial asthma. Okay, so that is the reason why we are avoiding the morphine. Other vital points also I have added here. Please make a note of it. It will decrease the rate and depth of respiration because it is suppressing the respiratory center, which is medulla oblongata. Understand, guys? And one more vital point is it is contraindicated in head injury and acute pancreatitis. Why in head injury? Obviously, in head injury, if we are administering morphine, means it will suppress the respiratory center. That is one reason. And other thing is acute pancreatitis. Why we should not give this drug in acute pancreatitis? If you are giving this drug in acute pancreatitis, as you all know, sphincter of OD. Sphincter of OD is the one which is connecting the duodenum and pancreatic duct. Okay, the in between place, the pathway is called as what? Sphincter of OD. This sphincter of OD will become collapsed or it will become paralyzed. It will not do its function. Understand? So we should not administer morphine in case of acute pancreatitis, head injury, and bronchial asthma. Okay, so all other options like angina, stroke, pulmonary edema, we can give this drug, no issues. Okay, but bronchial asthma, head injury, and acute pancreatitis, we should not administer morphine. Okay. Next, which of these drug is nephrotoxic? Direct question. They are asking the nephrotoxic drug. Let's see the options. Diuretics, ACE inhibitor, NSAID, sodium or potassium bicarbonate. Okay. So nephrotoxic drug among these 4, which is a nephrotoxic drug? Here the right answer is option B, that is ACE inhibitors. ACE inhibitor is a nephrotoxic drug. So why we are considering is as a nephrotoxic drug? For understanding this concept, first you should know about the RAS mechanism, that is renin angiotensin aldosterone mechanism. So here you can see the RAS mechanism. See, what is ACE? ACE means angiotensin converting enzyme, right? It is very, very essential for converting angiotensin 1 to angiotensin 2. You can see here in this image, it is clearly explained the RAS mechanism. Let me brief you about the RAS mechanism first. See, angiotensinogen, whenever the BP is decreased in our body, whenever the blood pressure is lowered in our body, immediately what will happen? The RAS mechanism will get activated. So what is RAS mechanism? Where it is getting activated? It is first activated from the liver. In the liver, angiotensinogen, this enzyme will be released. This enzyme, it is a inactive form. So how it will become active form? By means of renin. What is that? Renin. So renin, it is secreted from the kidney. Okay, and this one will convert the angiotensinogen to angiotensin 1. Okay, but still angiotensin 1 is also in an inactive state. So angiotensin 1 has to be converted to angiotensin 2 in the presence of ACE inhibitor. Now you can see the ACE, not ACE inhibitor, ACE. Okay, angiotensin converting enzyme. So this angiotensin converting enzyme, which is secreted from the lungs as well as from the kidney, this ACE is going to convert the angiotensin 1 to angiotensin 2. Once this conversion taken place, immediately the sympathetic nervous system will get activated. Adrenal cortex will get activated, especially the aldosterone secretion will released. Once the aldosterone secretion is released, means reabsorption of sodium and water will take place in order to maintain the blood volume. Sympathetic nervous system is activated in order to contract the blood vessels so that the blood pressure will be maintained. Okay, and here you can see arteriolar vasoconstriction, that is the BP will be maintained because the arteries are contracted and BP is maintained, and antidiuretic hormone secretion is increased so that the excess urine output will be decreased and the fluid is retained within the body. So on the whole, what is happening? The blood pressure is maintained, right? So this is happening in the ROS mechanism, and ACE is playing a very important role in this ROS mechanism. Whereas in this question, it is the option is not ACE, it is ACE inhibitor, right? Here you can see. So in case of any kidney injury, okay, we can administer diuretics, we can go with the non-steroidal anti-inflammatory drugs, we can go with sodium and potassium bicarbonate, no issues with that. But ACE inhibitors will cause decreased blood flow to the kidney. Okay, already the kidney is injured, right? Fine. If you are administering ACE inhibitor, the further decrease of the blood flow will take place to the kidney. Okay, so further ischemia to the kidney will take place. So further damage of the kidney will take place, not only because of ACE inhibitor, other problems are also there. If the patient is having heart failure, so cardiac output is going to decrease. So that time the amount of blood which is going to reach the kidney is also going to decrease. In that time also, what will happen? The kidney injury will take place. Not only this, if there is any hemorrhage, severe depletion of the circulating blood volume will take place. So that time also decreased blood flow to the kidney and kidney injury will take place. So whatever it is, at the end, if the kidney blood flow is decreased, the ischemia to the kidney is taken place, means that time what will happen? Injury to the kidney will take place. And according to this question, so which is the right answer? The nephrotoxic drug is ACE inhibitors. Fine. So I have explained about the ROS mechanism also. The next question is, see this question asked in RRB examination, which of the following agent causes discoloration of teeth if taken with milk? Here the key point is they have given discoloration of teeth if you are taking along with the milk. Let's see the option, then only it will be clear for you. Tetracycline, penicillin, metronidazole and ciprofloxacin, 4 options they have given here. So which among the drug, if you are taking along with the milk, it will cause discoloration of the teeth? This is the question. And here the right answer is option A. It is very simple and direct question. It asked 2 times in exams. Okay. So here you can see how it is causing discoloration of teeth. That is the question, right? See, the milk, it is contain calcium. The calcium and tetracycline together, it will cause what? Straining on the teeth as well as in the bones. Okay, discoloration in the teeth as well as in the bone. It is a direct question. Rational is also direct. Okay, hope you have understand the questions, right? So this is how it is causing the discoloration of teeth. Okay, guys, fine. Hope each and every questions are clearly understood to you. If there is any doubt in these 5 questions or in any rationals, you can drop your message in the comment section, guys. And please keep watching the channel. Those who are watching the channel without subscribing, please subscribe the channel. Then only whatever the video we are placing in the YouTube, it will reach to you the exact time. Okay, and thank you very much and all the best for your upcoming examinations.